How often does knee replacement necessitate more surgery? This question is asked sometimes by patients who had previous bad experience with other surgeries when they had to undergo more surgeries after first major surgery. After knee replacement surgery, if everything goes according to plan, you will not need any more surgeries for at least 20 years and maybe longer if there is no wear and tear or loosening of implant. In some cases, 1% to 2% of the cases, you may necessitate one or more surgery. The reasons for more surgeries after knee replacement surgery are: number one is infection. If immediately after the surgery you develop infection because of low immunity or diabetes or any other reason, you will require more surgery like washout of knee joint or removal of that implant. The other times you may require surgery is if the range of motion is not improving, or there is a block at a particular level, or there is significant soft tissue stiffness. These reasons are nowadays very less with improved implant. So you will necessitate knee replacement surgery in only 1 in 100 out of surgeries. So basically, if you have infection, if you have loosening, you will require another surgery, otherwise you will not require. Thank you so much.